Unit 1.4, Video 4. In this fourth video, we will present the other two non-communicable conditions that are frequently observed in people suffering acquired disability. They are neurodegenerative diseases and the condition of osteoporosis or osteopenia. Well, probably the most important aspect that should be mentioned to understand the relationship between traumatic brain injury and neurodegenerative diseases is the neuroinflammation. Sustained cerebral inflammation contributes to chronic TBI condition. The diagram of these slides summarizes the multitude of medical conditions that arise acutely and progress in the months and years following the brain trauma. Nowadays, much attention is given to the long-term conditions that severely affect the quality of life of the patient, potentially leading to morbidity, depression, dementia, and even suicide. What is important to understand is that the traumatic brain injury condition strongly induces inflammation immediately after the trauma, but also in the months and years that follow. This chronic condition is probably responsible for the development of neurodegenerative diseases such as Alzheimer's or Parkinson. In this frame, it's easy to understand that any other condition that can lead to an increase of inflammation can exacerbate the development of neurodegenerative diseases. So obesity, but also in general a metabolic syndrome condition, aggravates long-term post-traumatic brain injury dysfunction. Obese individuals are more likely to develop neurodegeneration related to their traumatic brain injury with respect to normal weight individuals. In addition, obese patients with TBI develop more easily the comorbidities of obesity, such as type 2 diabetes, apnea, hypertension, dyslipidemia, vascular diseases, and so on. Many of these diseases contribute to the cognitive decline, accelerating the effect of TBI. The diagram on the right wants just to summarize that on one side, traumatic brain injury represents a risk factor for cognitive impairment and neurodegeneration, but at the same time, traumatic brain injury induces some lifestyle changes, leading probably to the development of some metabolic diseases, such as diabetes or cardiovascular diseases, which in turn represent a risk factor for developing cognitive impairment due to the inflammation they induce. So this is the reason why it is so important to counteract the development of metabolic syndrome in subjects suffering acquired disability. Finally, a condition which is often observed in people suffering acquired disability is represented by osteopenia or osteoporosis. The two terms refer to a different situation. Osteopenia is a condition in which there is lower than normal bone mass or mineral density. Somehow, osteopenia is a less severe form of bone loss than osteoporosis. Osteoporosis is a condition in which there is decrease in the amount and thickness of bone tissue. This causes the bones to become weak and break more easily. Osteoporosis may be caused by older age, hormone changes, but also certain drugs or a not sufficient intake of calcium or vitamin D. It may also be caused by certain type of cancer or cancer treatment. There's a relationship between acquired disability and bone mineral density. It is well documented among elderly patients suffering stroke that they are at higher risk of vitamin D deficiency. Low vitamin D level as well as prolonged or forced immobilization are cause of low bone mineral density and consequent fractures. Some drugs used in patients with traumatic brain injury may induce metabolic bone diseases. And moreover, lifestyle changes and reduced mobility can negatively affect bone mineral density. In people with acquired brain injury, there's higher prevalence of osteopenia and osteoporosis than in the general adult population. So thank you for your attention, and of course I invite you to deepen these concepts with the supplementary material provided together with the unit.